Hi there, I'm Mabel Jong, and you're watching the World Healthcare Congress Interview Zone, and I'm very pleased to have Dr. Jeremy Corbett with me. He is Chief Health Officer at Nurtur Health. Dr. Corbett, thank you so much for your time.
Thanks for having me.
Well, tell me about Nurtur Health.
And Nurtur Health is a health and wellness company focused on bringing behavior change for a population, whether that's in the employer space or the managed Medicaid space.
Okay, can you talk a little bit about what the return on investment is investing in wellness programs versus doing nothing at all?
I think it's an interesting topic, and I think with recent studies that have come out, I think the topic is certainly at hand, and it's in front of everybody. I think the question really needs to be, what is the cost of not doing health and wellness? I think it's difficult to put a monetary amount on utilization, et cetera, in a short period of time. And in fact, if you went to a CFO of a company and said, hey, we're going to invest in wellness, and initially we're going to drive up costs. We're going to drive up preventative care, vaccinations. We're going to drive up pharmacy costs. We want people to fill their pharmaceuticals. We're going to drive up preventative health care visits to the primary care visit, doctor office. It's difficult to actually find out that you've got savings until many years down the road. Mm-hmm. So I think much of the conversation now is, do we have savings immediately? If I implement this program right now, am I going to see something at the end of the quarter? And the answer is, of course not. Mm-hmm. The question I would ask is, what are you saving? What are you creating in terms of creating a healthy culture in your employee workplace by pushing prevention, pushing weight management, pushing better dietitian care or dietary care, et cetera?
Okay, and do you have data on what kind of programs work well versus others that don't work at all?
I think we have very good data on what brings about better quality. I think of many of the questions, and if you ask most of the competitors in the workspace in health and wellness, many people are struggling with actually the ROI, the actual true financial dollars saved in a health employee space or health employee program.
Mm-hmm. We've seen a lot of different trends come around, for instance, paying people to be well, paying people to exercise, to actually walk every day. Do you have evidence that those kinds of programs work?
Absolutely. There's no question that when you incentivize people, and incentives don't always have to be financial, incentives can be providing money to a local charity. There's a large tech company that we partner with that stopped providing incentives in terms of a check back to the employee and started investing in a charity of their choosing, and found engagement rates went through the roof.
Oh, wow.
We have found that, you ask about ROI, the real question is, are we getting patients today healthier than they were yesterday through a health and wellness program? And we have great data that shows that we can get patients healthier. Healthier, though, is a term that's difficult to define, and whether that's actually specifically saving money or getting somebody to have a lower BMI, a lower blood pressure, or a lower hemoglobin A1C, it really depends on who's asking the question.
Now, any risk of information fatigue or people feeling like they're too pushed around to do things that they might not be interested in?
Absolutely, and Nurtur is uniquely positioned. We have health coaches. What we do is we engage one-on-one with a member to walk down that care continuum with them. Even a very highly educated employee has difficulty asking questions and getting answers about the health concerns. Now, how easy is it to actually call up your primary care doctor and have them, number one, pick up the phone, number two, answer a question?
Right.
So what our coaches do is really hold the hand of an employee and walk through and across or through the barriers that actually keep them or impede them from getting better health care. And we found very, very good evidence that if you do it in one-on-one fashion, the results are there.
Okay. Dr. Corbett, what is your message here at the meeting this year?
I think my message meeting would be twofold. Number one, in order to actually look at results, we've got to have a long-term focus. We've got to push that line or that end finish point out there a little bit. And number two, I think there's a very, very real risk of us de-incentivizing health and wellness to the detriment of not just an employee workplace, but the employee themselves and therefore the community. I mean, healthy employees create healthy workplaces. Healthy workplaces create healthy communities. But all that starts with an employee, a person, and that's what Nurtur does best. Individual, person-centered care.
Okay, great. Well, thank you so much for your time today.
Appreciate it.
And I'm Mabel Jong. Thanks for watching.